This is your lecture for Chapter 15 out of your ADA book, Dental Insurance Processing. Types of dental insurance include fee-for-service, capitalization programs, closed panel programs, franchise dentistry, direct reimbursement, PPO, HMO, managed care, individual practice association, and union trust funds. Other types of insurance coverage could include secondary coverage, government assistance, workers' compensation, auto accident coverage, and other accident coverage. Insurance claims processing. We're going to collect information and determine benefits, determine the maximum coverage, deductible, percentage of payment, the patient's co-payment, is there any limitation to coverage, if the patient is eligible, and if we need a pre-authorization for any treatment. We can electronically submit forms. This means submitting electronically to the insurance company for payment, using our practice management system, application service providers, and e-claim service providers. Individual insurance providers also provide the capability to process e-claims. Or we can use the paper dental claims form and send that through the mail, and use super bills and encounter forms. A voucher is attached to an explanation of benefits form. This is going to give the patient's name, group number, or other identification number, adjust any fees, and then breakdown of payment. We then receive the payment and post it, making sure that it matches the EOB. With insurance tracking systems, we have steps in a manual insurance tracking system. They include placing a copy of the dental claim form in a file for a month, for the month that the claim was made. Once we get the payment, we're going to pull that claim and staple it to the EOB. After 1 month, we'll review any claims that are remaining and place all paid claims in a file for the month in which the claim was paid. We want to know each insurance group's details, identify details of the insurance company contracts, use appropriate fee schedules, check all claims for accuracy. We want to develop a tracking system that works for our office and design a system to follow up on unpaid claims. We'll use the tracking system to identify uncompleted or authorized work. We'll bill the patients once receiving the insurance payment for their portion, and we're going to keep no copies of dental claim forms in clinical records. The two basic routes of payment for the insurance company are our manual or electronic, and then we will use an ADA dental claim form. To complete the dental claim form, we'll use a laser printer with black ink, a 10-point font in all capital letters, 8-digit dates with no spaces. This is going to be printed on a standard 8x5 by 11. And we'll use the fees with decimal points. We don't want to use a freeform text, ditto marks, or stray marks, lines outside the boxes, any correction fluid, or more than one font style. Sections of the form include header information, the insurance company information, other coverages, the policyholder and subscriber information, the patient information, the record of services provided, authorizations, the claim and treatment information, the billing dentist or dental entity, and the treating dentist and dental treatment location. We'll obtain the information from the patient. We're going to verify their coverage, discuss the coverage with the patient, and determine the patient's portion. We'll complete the claim form, include documentation needed, record in the patient's clinical record, record the information in the tracking system. We'll post insurance payments, bill patient the balance, record the payment in your tracking system, and then follow up on any unpaid claims within 30 days of submission. Our current dental terminology, CDT 2019, is published by the ADA. It's cross-referenced and easy to locate as a procedure numerically. The first section of the manual is divided into 12 categories. They include diagnostic, preventative, restorative, endo, perio, prosthodontics, maxillofacial procedures, implant services, prosthodontics, surgeries, orthodontics, and adjunct. Documentation that's going to be needed for insurance processing. So most claims don't need documentation, but some common procedures might require it. And they're going to be your x-rays, periodontal charting, if we need a narrative written by the treating provider, and then the dental provider taxonomy.